Hello everyone, this is Witty Dog. Welcome to MCQ series. Here we will solve MCQs which are very important, and solving a single MCQ will help us to understand a particular concept so that we can solve more MCQ on a particular topic. So today's question of the day is, tongue deviates to the right side of on protrusion. This is because of paralysis of. So there is anatomy involved, tongue. We have to know tongue anatomy, and there is pathology is that there is a right deviation of the tongue. Alright, so this is the paralysis of. The options include right hypoglossal, left hypoglossal, lingual nerve, and left facial nerve, right facial nerve. So these are the options. So the question is from a general medicine, a CNS topic. So let's hop on to the solution. So for this we have to know all the muscles of the tongue and their innervation. So the muscles of the tongue are of two types. It could be intrinsic muscles or the extrinsic muscles. The intrinsic muscles are four pair of muscles which include SL, IL, V and T, superior longitudinal muscle, inferior longitudinal muscle, vertical muscle and transverse muscle. These all intrinsic muscles are innervated by hypoglossal nerve, which is the 12th cranial nerve, and extrinsic muscles include S, H, G, styloglossal muscle, hypoglossal muscle and genioglottal muscle. These extrinsic muscles are innervated by again hypoglossal muscle 12. Another extrinsic muscle consists of the palatoglossal muscle, palatoglossal. This is innervated by 10th cranial nerve, which is the vagus nerve. Again, let's look at the tongue. This is the anterior 2/3 of the tongue, and this is the posterior 1/3 of the tongue. This anterior 2/3 of the tongue, the general sensations are supplied by V3, which is the mandibular nerve division of trigeminal nerve. Which part of mandibular nerve? The lingual nerve. And the taste sensations are innervated by a facial nerve, which is 7th cranial nerve. Which branch of facial nerve? Chorda tympanic branch. Alright. And posterior 1/3 of the tongue, both sensory and taste sensations are supplied by none other than glossopharyngeal nerve, which is 9th cranial nerve. Alright, that's all the basic knowledge we need to solve this question. Let's look at the pathology of these nerves. If there is lesion including the hypoglossal nerve, so these muscles will be involved in hypoglossal nerve injury. So 12 or hypoglossal nerve lesion will involve the tongue. Okay, the tongue, and this tongue will deviate towards the diseased side. Okay, we are studying pathology now. So lesions in the hypoglossal nerve will lead to tongue deviation towards the diseased sides on protrusion. Okay, next nerve is a vagus nerve. Okay, if there is a vagus nerve lesion, so it will lead to uvula, deviation of the uvula on palatal elevation. The uvula will deviate towards the opposite side or the healthy side. Okay. Next, we have this V3, that means trigeminal nerve, which is nothing but 5th cranial nerve, trigeminal nerve. This trigeminal nerve, remember, involves the jaw. The lesions of the trigeminal nerve will lead to deviation of the jaw towards the disease side. Okay, any lesions in the trigeminal nerve will lead to deviation of the jaw towards the disease side. The last nerve is the facial nerve. So the 7th or the facial nerve lesion will lead to angle. Remember, angle. The deviation of the angle of the mandible towards the healthy side. Okay, that's all we need to know to solve MCQs like this. How to remember this thing? Just know that this 5 means trigeminal nerve, 5th cranial nerve is a jaw. Okay, jaw. And this 7, this is how we write 7. So this forms an angle, so it involves the angle. Okay, this is how you remember. Hypoglossal muscles, maximum muscles of the tongue, including the intrinsic muscle and extrinsic muscles, are innervated by hypoglossal muscles. So the tongue will deviate towards the disease sites in hypoglossal nerve injury. And lastly, the vagus nerve will deviate the uvula towards the healthy side in case of its lesions. Okay, that's all we need to know. Get back to the question. The question is tongue deviates to the right. So here we can see it is tongue. Okay, tongue. That means hypoglossal nerve. So these two options will be definitely eliminated. And then right side on protrusion. Okay, we know that hypoglossal nerve injury will lead to deviation of the tongue towards the affected side of the disease side. So the disease side is the right side. So the answer will be A, right hypoglossal nerve lesion. Okay, that's all for today. Thank you for watching this video. Make sure you subscribe.